It being 5:30, we'll call the, what's today, the 17th?
Yes.
The October 17th meeting of the Ayer Board of Health to order. And the first item on the agenda is an executive session pursuant to Mass General Law, Chapter 30A, Section 21A, Exemption Number 3, to discuss litigation strategy with respect to the case of Mimi's Place LLC versus the Board of Health of the Town of Ayer, Middlesex Superior Court, case number 2181CV4967. If discussing the matter in open session will have detrimental effect on the town's litigating position, and the chair so declares, and the chair does declare. This meeting is also an in-person meeting. It is not a Zoom meeting, so just so everyone knows. Is there a motion to go in executive session?
Yes, I will move. We go into executive session.
I'll second that.
Motion's been made and seconded, hearing no discussion. All those in favor, Ms. Papineau?
Aye.
Ms. Peters?
Aye.
Mr. Slarski? Aye. So the board will go into executive session just to come out and go back into open session. We're going to start with COVID update. Bridget, do you want to do that first? There's really not much to talk about. The numbers for the town of Ayer are below the county and below the
Right.
state.
And what I've been doing, because we have so many COVID test kits, I've been actually handing them out when we do food inspections, just to the restaurant, so.
So I was at Bridget's office last week. There must be 50 cases, not 50 boxes, 50 cases.
There's so many.
They're just,
Oh my God,
they're piled up
really?
from the floor to the ceiling. It's like, really?
And I stopped.
Oh my God.
I know we said 2 per family, but and only what I stopped.
2
I was
cases.
like, great, you're here, have fun.
Yeah.
Jeez.
I mean, it's just, and we have some of the cases that we have at our office, so I just take them and,
And money couldn't buy one, you know, what, a year ago or
It's
even
crazy.
less? Yeah.
And the,
Well, if
is
anyone
the
wants test
expiration
kits,
dates
they-
being changed?
yep, they're on there. What I do is,
Well, because the sticker, if you scan that, it says they expire in October.
yes, so they've been extended. If
Okay.
what I've been doing is, and I meant to print this, but I didn't. If you go to iHealth, they have a,
Okay.
I think it's on their website, but you can get a printout of
Okay.
the expiration date. So
Like
if
you can put in your lot number? or
yeah,
So
we'll
it's
just
by
give a
lot,
list and
yeah.
it will show you. So like the July ones,
Okay.
or this is August, I think go to February maybe, or June.
Oh, okay. good.
January.
Because the
That's
box you gave me from August
Yep.
expired in October.
Yeah, and so that was good now, I believe, until January.
Okay. good
So
to
if
know.
you go on
Great.
the iHealth website, and they'll probably extend them again,
That's what I figured, but
so.
Yeah.
So CDC did come out with a statement saying they expect an uptick in cases, and I
Yeah.
think that that's happening.
It is.
So
Yep.
people that are at high risk should take heed. Bridget, do you want to do the Neshoba thing, or do you want to talk about Sandy Pond first?
We can talk about Sandy Pond.
Okay.
So I've been going out weekly, sometimes a few times a week, just to observe the pond, to look at it. I take a sample, we put it through a fluorometer at our office,
Yeah.
and anything, I think Ayer said under 70 is sort of acceptable. Today's air Sandy Pond was 150 colonies per
Ah,
milliliter, I think it is.
Yeah.
There was almost 1 million before, so we have really,
It's still bad, but we've come way
we
down.
have, and the
Okay.
clarity of the water is much better.
Mhm.
There's still a little film. As soon as that clears up, I'm going to make the request to the state, and I'll copy you on it, for them to test and
Yeah.
do the formal lifting of it. But to
Okay.
get to that point, we really want that number to get down, and the clarity to be.
Yeah. Does it get better or worse as you go deeper?
So before you couldn't really see, like if you were on the,
Yeah, it was like.
you couldn't see
yeah,
anything.
like- Yeah.
Now you can see down a lot more, especially at the
Okay.
park
Okay.
where the docks are.
Yeah.
But Jess from Conservation had sent me some pictures from her end of the pond. And that still last week looked like Grinch had been there. So
Wow.
even though it's clear and where I have access to,
Yeah.
there are
right,
other areas, so
right.
I don't know if that's resolved.
Bridget and I talked, because I stopped this morning a couple times and looked at the water, and I thought it was much clearer than it has
Yeah.
been. You can see the bottom of the pond again.
If the state lifts
Well-
does it just go by the measurement they take up the public beach? Or?
No, there has to be 2 samples that fall within 7 days of each other that are at an acceptable level. And I guess the acceptable level is below 70,000 colonies.
Okay.
So the advisory from our perspective would continue until the state or an independent laboratory comes back and says there are 2 tests that meet the standards
Yeah,
of the
okay,
state.
I got it.
But I was saying to Bridget that the pond is, in the summertime people swim in it. People
Yeah.
swim in it this type of year too. I mean,
Yeah.
but it's still used for kayaking and people walk their dogs.
Mm-hmm.
And I think as soon as it's at an acceptable level to use, we need to let people know that.
Yeah.
But we need to have information that it has fallen below
Yeah,
the
yeah.
appropriate level before we can say that.
Well, that's why I was wondering if it's different, if it even looks different in different parts of the pond.
On-
Well, it must, if
They
you
have
said
to.
that the other
Mm-hmm.
lady conservation, it was very green
Mm-hmm.
compared to the public
I stopped at
beach.
the bridge and I looked down where our house is on the pond, and
Yeah.
it's definitely clearer than it was, no question about it.
Okay.
The other thing that happens this time of year, though, is the water on the top becomes more dense and sinks to
yeah.
the bottom. The pond does a turnover,
Does that turn
and there'll be a week that the pond is just looks awful,
really murky?
and so that's going to be coming up soon too.
It rains and pours.
But I know you've got people calling you and asking about the pond. I get people that ask me almost every day.
Yeah.
So as soon as, testing is done that shows that it's at an acceptable level, we'll pull the signs and, matter of fact, maybe we'll even post on the sign that the pond has been tested to an acceptable level for a week or something.
And
So that is just, I can't. Sorry.
And it's still only in Sandy.
Yeah, you
right?
said you got some colonies in Flanagan's, but it was much lower, right?
Yeah, it was really,
Well, I think
Okay.
algae is going to be present no matter what. It's a
Yeah,
natural
yeah.
occurring part. A toxic bloom is different than algae
Yeah,
being present.
yeah.
so I don't know if that's.
Oh my God.
and
So
where is
that's
that?
wild.
That's from Jess's, the conservation.
No,
Ah.
what side of the pond is she on?
She's in
The
the
other
cove
side.
on the other side.
Yeah.
So that was,
Opposite the bridge.
Yeah, and-
yeah.
Okay.
But it could be the way the wind is blowing.
Yeah,
Yeah,
that's
it's
true
different
too.
variables.
so that was just, this is another one. So it's just, sorry.
But I think the rain is also helping to dissipate it.
Oh, yeah. I
So,
yeah.
okay.
Mm-hmm.
This is, I saw this one day at the beach, but I haven't seen this as bad at the beach. It was just really cloudy. You could see some green,
Yeah.
but not quite like that. So,
That's wild.
And if we get if we get our first frost, that will affect.
yeah, I
Some of
think
it?
I think that's when it starts to kill it
Yeah.
off.
That's good.
So that's the update on that. And I sent an email to the park department as well, just putting that in writing. I did talk to Jeff today. So we have just our staff assignments for town, so if anybody ever calls you looking for somebody else, which I feel like you get a lot of that,
Yeah.
this just tells you where we
Oh,
are.
good, because I have one from 2014, and
Yeah.
that wasn't helpful.
So that's the updated one. So I had a complaint regarding McDonald's, went out, I did not go out there, Shelley went out there. It needs some TLC. I emailed the owner of McDonald's so he knew right away. And we will get a copy of that inspection report. So because we use these computers now, it's in,
yeah.
until we get back to the office and sync them, so I can't get Shelley's inspection until she gets
Okay.
back. So, but we'll follow up, she's gonna go back.
Okay.
The Ayer Shirley High School concession stand is open, so
Oh,
that's
okay.
inspected
Yep,
for that.
that's right.
Did I
We'll
tell
have
you,
to go to
could I
that.
start emailing
Yeah.
these to you?
Please do.
Yes, so from now on, we're gonna email these, so we don't have paper, we don't waste paper. Karen's Kitchen, that was fine, no major issues. And then we're in the middle of our renewals, so we just have the food permits that were issued for a bunch of places. I don't know if you want to look at them or just file them. Air shop
Wait.
and save.
Weren't we talking about the permits coming to the board because of what happened with Mimi's permit being issued automatically?
So I thought they was okay to issue the food, and then the beach and the camp and stuff and everything else, just because of the sheer number of them.
Let's talk about it, because
So if we have to do that, we have to pull everything and bring them to a meeting.
this is not personal, Bridget, at
Yeah.
all, but after what happened with the permit being issued erroneously, we came back and said we wanted the permits to come through the board before they were issued. And if we don't want to do that, then we should say it's okay. But you guys know what a problem that's caused, having,
Yeah, I know. I'm trying to remember our discussion. I honestly don't recall what, if we said that, like, restaurants were going to be separate or not.
Because we'd have to pull them, and then you're not going to get them possibly until November, and they'll already be expired. You know what I'm saying? So some of them
I
come
do,
in
yeah.
the day before they're due.
hmm.
That's a tough one, because they really want to get them in the habit of, oh, it's okay if you're,
I mean, if
you
it's
know,
any
license is
comfort,
expired
if
by a
it's
few
any
days.
comfort, they're renewals. They're not new. It's
No brand new.
Right.
it's just a.
I think the board definitely wants to see them.
Before
Whether-
we issue them?
That, I don't know. I don't want to be a cog in a wheel, but I also want to be aware of what's going on personally. I don't know how you guys feel about that, but
Yeah, it's a tough one, because that,
That's a different, but that's different than what we went through with that other
can
being.
there be an
Things,
email at
just
the
like
time
this.
that they're being issued that's sent out to us, and that way we don't have to see the permit? But if you've got a handful, whoever's doing that, just put it in an email to us that these are being renewed.
So I can, after,
yeah.
just, so we have different people that, so Shelley's doing the renewals. What I can do is pull them and just send an email that these are the ones
Yeah.
that are
Like,
coming
just send
in.
scans
Sure.
or something.
Just, I mean, and I'm just saying that because if everyone
Yeah,
did it.
yeah.
I-
Yeah, that's what I'm a little concerned about, getting us in the approval loop for it, because I don't want to hold things up.
No,
Right, but
why don't you just send us the list, and if we have an issue with something on the list, we can get back to you. If not, it's just let
Yeah.
it go.
So I'll just do a,
I think that would work.
send out an email, just probably hold them. I mean, I don't think, these come in, there's probably 60 places in Air, so rather than send out 60 emails, just, I'll lump them together and say these are the following that were
Sure.
renewed. Okay,
Yeah.
Yeah, that would be good.
so.
There are that many places in Air? Well, yeah, because when you include
Well,
the things that are like
so-
stores, they have a, yeah,
So this is
that's true.
Shop and Save, Pauline's, there's a place called the Korean Rice Cake Bakery, Archer Mobile, that one's down next to Devon's Pizza. She does wholesale too.
Oh, okay, yeah.
Taco Bell, Walk and Roll.
Yeah, when you get into I think the stores really expand it a lot. I tend not to think, yeah, I'm thinking,
Cage
there are
Hilltop.
60 restaurants in Air?
Shirley High School, Alltown Fresh,
Yeah,
Alltown Fresh Catering.
yeah, the school, the
Dunkin'
housing,
Donuts.
yeah. Yeah, that
Maybe
adds
not
up.
60, but maybe. I don't know.
More than
Yeah,
enough.
but that- yeah, that's,
So,
that does add
can
up.
you clarify for me, I'm not understanding. So if Bridget sends us an email and says, these are the ones that are being renewed,
Yep.
Yeah.
it's just a blanket statement, these are the ones that are being renewed. It's
Right.
not giving us any detail.
Right.
Unless, but if you've got something that you don't want that to be renewed, or you want it to come before the board, you would email back saying, hold up on this permit, bring it to the
Yeah,
next
that would
board
kind of be
meeting.
your,
But how would we know that? Why would we even have a
Well,
question
you
about
might have an
that?
issue. You might have an
Yeah.
issue on something. I mean, you
So
might-
email I'm sending you would be that they were already issued, so we couldn't hold it up. So you want me to hold them up?
At the time that being issued, at the time that you get the renewal, you would let us know that you've received the renewal, that's all.
Okay.
And unless someone says something to hold one out, then they would just be renewed.
Okay.
Yeah, I don't think you have to hold them, you just get a list together of the ones that are being renewed, and if no one has any issue with that, then let it go.
So would it be, and I'm just asking, I'm trying to make it easy for all of us,
Yeah.
before we do the renewal, so moving forward, just at a meeting, ask if there's any issues with anything that you want me to hold?
Sure.
I mean, and so we could do that.
Yeah.
Yeah.
Actually, that's not a bad idea too, because you're right, Trish, we'd have to be aware of some
Yeah, I feel like.
issue. Like, we were with the other license, kind of just aware that things were going on. With the restaurants, I guess it would have to be an issue where we're just aware of something.
If someone said something to you, or if you had a personal experience that set off a red flag,
Mm-hmm, yep.
and part of what we've talked about tonight was I had a red flag at one of the restaurants and that
Yeah.
we discussed.
Mm-hmm, yep.
So, but it's being resolved.
Yeah, yeah.
But what if it was something that was really egregious?
Yeah, right. But
Yeah.
it would have to be something that either we're aware
Yeah.
of from somewhere or from a meeting.
But
so.
if we don't have any knowledge that it's being renewed,
Right.
and then it's done, it's still our responsibility. And if there's a problem, it's still our responsibility.
Yeah.
I
Yeah,
just think,
this is
I
true.
think we should
Yeah.
know about it, that's all.
Yeah, right. That makes sense. That's fine.
You good with that, Trish? Sure.
Yeah, I just, I just don't want it to be after the fact where it's a blanket, list of
Right,
things.
yeah,
and it's
yeah,
like,
yeah, yeah.
oh yeah, thank you, Bridget, that was great that you sent that, and then something comes up, and it's like,
Yeah.
well, you not signed off on it, but you
No, but the
you
time-
get these emails
At
and
the
you know.
time of the renewal,
Right,
before she sends it out, just, this is coming up, and that would be it.
Yeah, these applications
Yeah.
even were received.
For this meeting, would it be okay to just go through the list real quick? and
Yeah.
see?
Sure.
So. Because I can just pull everything up right here. Um, It's slow in here. In the meantime, while I'm pulling this up, there was a housing that was done on 23 Shirley Street. It was a few months ago. They weren't gonna re-rent it until they took care of everything, but I hadn't heard anything. So I just sent a note out just to cover our bases.
Oh,
basically.
okay, to make sure it's not,
23, I'm trying to think what
not rented yet, or
23
whatever.
Shirley Street.
Past the church, isn't it, on the
Yep.
left-hand side?
Yep.
It would be where Union Street comes in. Remember where my uncle used to live? Louis?
Yeah,
Union Street, the house at the end, on the other side though, Shirley Street goes down
okay.
to the other side.
So I'm gonna go through these really quick. There are a lot. Okay, ready?
Sure.
So we have Cozy Maple Bakery, which I think is out, I don't know if they're still operating. Upon a Cake is a residential kitchen.
Who's
Upon a Cake,
that?
it's right over the bridge over there. They do just baking.
Oh, huh.
Yep, retail.
In someone's house,
Yep.
resident, what?
12 Leaves Made. Grateful Dog is the hot dog lady.
Yeah.
Air High School Concession, Golf, Air Package Store, which is on Main Street. Archer, Mobile Parents Kitchen, Global Montello, that shouldn't be in there, that was formerly 27, so that's gone. That has to be removed. Wujan, Page Hilltop, Wendy's, Air Shirley High School, Billiards Cafe, Pauline's, Verona, Devon's Pizza, Air Gun and Sportsman's Club, McDonald's, Air Senior Center, Neshoba Club, Air Convenience Store, Tiny's, Dunkin' Donuts, the hospital, Walk and Roll, Apple Valley, John's La Dip is a mobile food truck, Shaker Hills, Neshoba Park, The Cottage, Lucia's, Lazy Mary's, Subway, Barnum Road, Taco Bell, Shop and Save, Family Dollar, the Rice Cake Bakery, Air Park Department, Lucia, Osawa. There's another convenience store at 210, but they closed too, so that has to come out. Bar 25, Lazy Mary's, Ruby Donut, Junction, Penard's, Devon's Pizza, All Town Fresh, Fresh Air Nutrition, The Next Stop, Verk Gulf. That's it. No, forget it. We're done. That's a different town. So those are all the ones that.
That's a lot. It's really a lot.
Then those are all renewals.
Yeah.
Those are all renewals. So I don't think if you're okay with it.
Yeah, they're not inspected
Yeah.
before they're renewed though, right?
We do them twice a year. We
You do?
rotate. We try to. Sometimes it gets a little difficult, but some of them are twice a year. Some of them are 4 times a year.
Yeah.
So we do them, they're usually every 6 months. Some of them are only required to be done once a year. The schools are done twice a year, the hospital twice a year, nursing homes.
Yeah.
Yeah.
I'm good with it.
Yeah.
Okay.
Sounds good. Thank you.
Can you get a list, or can you send that list to Sam so that it's part of our meeting?
Yes.
Okay.
Yeah, I was kind of wondering.
But I'm
that.
gonna have to,
If we keep a
I don't know if I
list.
can pull it out of here, but I can just type it out for you,
Right.
just so you have it.
And I can always help next time you're in the office too. Don't.
Yeah. I have to figure out if I can export that from here.
Okay. Did you want to go through the animal inspector update, or do you want to hold off on that?
I would hold off, just let her submit the paperwork to the board.
Okay.
And then if we could get an update on the chicken permits, do we know if everybody's,
Everyone has renewed. She did call actually today. 3 people who had been on the list previously no longer have chickens.
okay,
2 of them have moved out of town, so therefore no more chickens. And then one of the residents, they sort of just moved in and inherited their chickens.
Awesome.
But they haven't submitted for a permit yet, and she was calling them today to let them know that, hey, now that you've moved in and have decided to take ownership of these chickens, please
Awesome.
submit a permit. But as it is, from what I have found from previous years' lists, everyone is up to date, and in fact, including the 2 people who have left town were up to date. They just left after they got the permit.
Okay.
So when you were saying to have her submit paperwork, that was for?
There was an inspection of a barn permit at the end of Pleasant
Oh,
Street,
okay,
which she
okay.
completed.
Okay, that inspection is done?
It's done, and but I have not seen it yet.
Okay.
And then there'll be a response on that as well.
Okay. So Julie is going to submit.
And my understanding is the inspection went fairly well.
Good.
I think there may be some things to talk about, but nothing
Okay.
that was earth-shattering, I guess.
Did Julie have the fellow from Groton
I don't know. Did she?
go with it? Yeah. That usually goes along.
But I think it went. I heard it went fairly well.
Good.
Bridget, anything else? Because I know you want to take off.
I don't think so. Oh yeah, wait a minute, I'm sorry, let me back up. So we've had a series of dumpster complaints.
Yeah.
Did I tell you the dumpster from the senior center was removed?
No.
Oh,
Oh, they took it away?
yes.
But
Okay.
I went down and looked at it. It was not overflowing. It looked like it came out of a car wash. That's how clean it was.
Mhm.
You know. And I think it was, from what I understand, one of the trash haulers, Republic, I believe, is having staffing issues. But that's not our issue. Our issue is, someone asks them to take their dumpster out, then it needs to be taken out.
So what happened is we subsequently had a couple of other complaints regarding overflowing dumpsters. 10 East Main Street. And then there was one over here at 11 Columbia.
Okay.
Once we call, they generally will come and pick it up.
Okay.
So both of these were really bad. So I called Republic, and I think Charlie actually got some complaints, so he called too.
They were both Republic?
Yes,
Are they both gone now?
yes, they're emptied.
Good.
Okay.
So that was just sort of an FYI.
Okay.
If anybody calls back, they've been emptied. There was another one
Yeah,
that was
what's
over.
Oh, I'm sorry, no, go ahead, finish your thought.
There was just another one that was overflowing. I went by there today, and it looks like that has a new dumpster company as well.
Okay. I was just wondering what this last one was about, with E.L. Harvey asking people to put their trash.
Yeah, you know what? I have
What's with
to.
that?
I have to call him back. I was kind of stumped with that because we
Yeah.
don't get involved with that. I mean, I would never advise. So my understanding when he called was, correct me if I'm wrong, they if he moved it across the street, would block the sidewalk.
Yeah, it blocks the sidewalk, or if he moved it where they asked him to, it's his neighbor's lawn. And he's like,
Oh.
I don't want to do that.
I don't think you should have to either.
Yeah, I don't think so either.
You know what I'm saying? I think sometimes maybe they just wanted.
So
Yeah.
what it is, from what I understood, because I did talk to him for quite a bit, Harvey got a new trash pickup truck, and it only picks up, I don't remember if it was the right
Oh,
or
it
left
only
side,
goes on
but it
one
only
side or
picks it on the
something.
one side, and because it's a one-way street right there,
Yeah,
they can't go down it the right way
Okay.
to use the one-sided pickup. Yep.
But can they not go over and get the barrels and
Yeah,
then put
that's-
the
Yeah,
barrel?
they don't.
that's
Okay.
what they
They-
should be doing.
Okay, that's not.
Probably staffing.
No,
Just
it
saying.
requires a little bit more work, but
Well, it
again,
does.
that's not our issue.
No.
And it's not an issue that I would want to try to give them a resolution, you know.
That's, and I,
The resolution
Yeah.
is if you have to get out and move the barrel manually, then that's what you're gonna do.
yeah,
Yeah.
so but I double checked with Charlie as well, just because that sort of toes the line of,
I'm sympathetic in terms of
Yeah.
trying to help someone, but that's,
yeah.
you know, they decide to use that truck, that's their issue, not
Yeah,
ours.
exactly.
Right.
Yep,
So
makes sense
anyway.
to me.
Sort of a, get a different truck.
Anything else for Bridget before Bridget takes off?
That's enough, isn't it?
Pam? Nothing?
Nope. That's great. That was a lot.
Thanks, Bridget.
Thank you.
Thank you.
Before we go on to PACE, I had one other item on the agenda. We had standing with the planning board regarding the tie-in, and I haven't heard anything back. I'd like to send a letter to the planning board, to the town planner, and CC the town administrator, just asking for an update regarding the information that we requested.
Yeah, what was the next step in that process?
We asked
Was it the approval of the plan?
We asked what the capacity of the line
Yeah.
was and what percentage of the houses on the pond were tied in now, and
Yeah.
would there be an impact of a development tying in before all the other houses had the ability to tie in on the pond?
That's the independent review that we
asked for
requested.
it, right. But
And is that then holding up getting the
We just-
plan
we-
approved, or?
no, we just haven't heard anything back, nothing. So I think just a letter that is nicely
Mhm,
worded.
yeah.
Could you please give us an update on the requested
I got it.
information?
Okay, I got it.
Are you guys
That
good
makes
with that?
sense. Yeah,
Okay.
that makes sense.
And Sam, I'm happy to sign it,
Okay.
but it would go to the planning board, the town planner, and CC Robert
Yep.
and the DPW.
Oh, and DPW.
Okay?
All right.
If-
I may ask, if I write it, I just need, because I don't know what was going on, I'll need some information.
Give me a call tomorrow
Yeah.
when you're free and we can do that.
I can write it, but it'll be big, so.
Um,
Great.
The approval of the minutes from the 26th of September. I wasn't at that meeting.
Yeah, that was just the two of us.
So were they already signed or?
Even though,
I think I signed,
You said the 12th, so no one signed the 26th. No one's seen them yet.
nobody signed the 26th, but this is, Steve's name is there for his signature, but this was the one where Bob and I were the only ones there. So,
I can change it. That's easy.
Yeah, I think
is
it should
that
be.
okay?
Yeah.
Just change that.
Yeah.
And then,
Well, you could approve the minutes pending the change in signature.
okay.
yeah, why don't we do that?
I'll make a
That's-
motion that we approve the minutes of September 26th with the change of signature.
Yeah.
Motion's made. Is there a second?
Second.
Hearing no discussion. All those in favor?
Aye.
Aye.
All right.
Okay.
Easy enough.
All right. And by the way, Sam,
Yeah.
I think you did a very nice job
Oh,
encapsulating, especially that whole discussion about Grove Street. Nice
Yeah,
job.
that was,
Thank you.
yeah.
That, you really distilled
It was
it
a
down
lot.
to its essence.
It
That
was
was
a
a
lot.
nice job.
Yeah.
thank you.
I like how you do that.
Kept it simple.
Yep.
So I have one other question. What is our next meeting date?
What do I have? I have got that we, for November,
We hadn't picked for November.
No.
I think.
Yeah.
because we had looked at the holiday schedule. Let me see.
I thought I had a calendar with me.
So November,
Get your phone.
11th is a Friday, that's Veterans Day, that doesn't impact us.
So it would be the
And that one
14th
doesn't
and the
move?
The
28th.
14th and the 28th? Does
Yeah.
that sound right?
If
So-
you do the 2nd and 4th like we have.
So the 14th and the 28th of November?
28th, yeah, 14th and the 28th.
Right. 28th is the Monday right after Thanksgiving.
Yeah.
Yeah, and what we usually do for that one is on the previous meeting, we'll just assess what's coming up and kind of play by ear if we need to have that one.
Perfect.
We're not meeting on Halloween?
Anything else?
That
Why
should
don't you
do
come
it.
join us?
Hey, I have to tell Lori I got an invitation to partake in that.
Yeah, we might want to call Laurel Shader.
Yes, I need her.
What's
I,
it called?
I have to call her. She can't call in.
Okay. Do you need her number?
Yes.
The survey. I got the
Oh,
email,
okay.
the contact information to schedule eligibility screening.
Did that
Julie, you wanna
come
hand
to
one
your
these out while
Board
I
of
get
Health?
the phone?
Nope.
Or-
I gave them this a long time ago when Lori and Laurel were putting it out there that they were going to set up shop, and I said I would so be interested in being part of that.
You would be a great one, having lived so close.
Yeah, yeah. Thank you. So we'll see. You too. You weren't far off the beaten path.
True.
It's nice where we used to play.
I know, I know.
I'm surprised I don't go out with some.
So the new veterans law affects me.
Laurel, hi. We're at the Board of Health meeting.
Hi, Lori. Hi, Board of Health.
Hello.
We're just starting. We're
Sorry,
just
I couldn't
getting.
be there in person tonight.
She's,
You're here in spirit.
she's calling in from Watertown.
Thank you.
Would you like me to get started, or do you want to read through? Okay. So thank you for having us. This is Julie Cornswood. I think you know Julie
Yeah,
too.
we've seen that
Julie's
too.
been with Paige forever.
Yep.
And I'm Lori Nearing. It's been a long time since we've been able to be with you folks.
Yeah.
How's COVID going? Are we over that, or yeah, right? I hope so. Oh my goodness. So what's interesting is you were the first board that expressed interest and showed a lot of support. 3 years ago now?
I know.
You all got busy. Our study slowed way down.
Yeah.
So we're really excited because we are in Ayer now. I don't know if you need a quick refresher on PFAS. Steve, I don't think you were here when.
I'm pretty familiar with
Briefly.
Yeah.
Okay.
We're actually getting
So-
educated on
Yeah,
that in
I'm
a
sure
bunch of
you
different
are,
ways.
but it's always
showing up.
changing.
Yeah.
That's what's so bizarre.
I know.
So Dr. Shader, Laurel Shader is on the phone, and she can answer specific scientific questions you may have because she's the researcher and she's the director of this program. So Laurel Shader's with Silent Spring Institute, and Laurel had written a grant to the CDC and ATSDR, a really large grant as part of a national study. And we were invited to participate in this national study through Laurel going back to 2017 or something, quite a while ago now. And so this study is taking place across 8 different sites all across the country. When the study is done, there'll be 8,000 people participating, and we're 1/8 of that study. So
That's awesome.
Laurel chose to look at both Hyannis and Ayer. The requirements of the study are that you have to have PFAS in your drinking water to qualify for the study, and it's being focused on health effects from drinking water, which is a pretty major source for the majority of exposures, we think. And we're learning all the time about where these fluoridated compounds are coming from, so you're probably up on all of that. It
Yeah.
seems to be in just about everything.
It's showing up in the news. It's
Yeah.
yeah.
It's in the
showing up
rainwater,
everywhere.
it's in sewage sludge, it's
Yeah.
recycled, it doesn't break down. So it's just like when we learned about the rain cycle, the water cycle when we were in 3rd grade. It just
Yeah.
keeps cycling around. Once we made it, it's here. And so we discovered it early on here in Ayer, probably because of Fort Devens and already watching a lot of the problems that they had imposed on our small town with arsenic in the soil and other sorts of issues. So Ayer is the very first community, or among the first communities in the state of Massachusetts to address this. And as I'm sure you know, it's now fully being filtered out at both Speck Pond and Grove Pond wells. Grove Pond has been up for a couple of years now, and Speck Pond was just completed, I think it was like the end of the summer, beginning of the fall. So we're fully filtered now, and so we feel pretty good about that. But we were all exposed if you were drinking the water. Even I have a home filter. I was probably exposed too because I'm not confident that the filter took it out. So I'm going to participate in the study.
But being fair to the town of Ayer, being a persistent chemical, it's not just in water. If you look, there's farms in Maine that the cattle is affected because they were using sludge from one of the wood plants, paper plants in Maine as a fertilizer. So whether
in
you were
consumer
exposed by
products,
water
yeah.
or you could be exposed from almost any source, but it's
Including probably what I'm wearing.
Yeah, I was thinking of that too.
kids fire retardant material is
Yeah.
PFAS
That was a
based.
big one.
Firefighting foam,
Yes.
AAA foam was
Teflon.
Yeah.
Teflon
Yeah.
that's used for
Yeah.
any number of non-stick surfaces.
Yeah.
So, yeah, I mean, it's just omnipresent.
It really is.
Yeah, I
It's-
think that's one of the reasons that the study is so important, because you don't have to have lived in a community like Ayer to be exposed, according to testing from CDC. Basically everyone has PFAS in our blood. We can get it from food and consumer products as well. So that really makes the study that much more important, because it really applies to everyone, regardless of where you live.
yeah.
I have a question, Laurel. It's when you're getting all these samples and you're looking at different levels, what, like you could feel perfectly normal or whatever, you're not sick, you don't have cancers, none of that, and it comes back high. Are there certain things that certain levels of certain things that you're looking for? I'm not making myself clear.
No,
You
I
know
understand what you're saying. Like, what does it mean when
Yeah,
you
what
get
should we
these
do?
results
Yeah, so if you.
What can you do? What should you do? What should
Yeah,
you think
and
about?
and what exactly are some of the things that they're looking for that are gonna be a red flag?
Yeah.
Or if someone is already, if
Sick.
somebody is already sick, does that make them ineligible for the study because of certain things that they're
Yeah.
doing for their illness.
Laura, are you able to hear that question?
Yeah, no, that was a great series of questions.
Sorry.
And I'll take them, I guess, maybe in reverse order.
That was from Trish.
So the first is, okay, thanks. I can't see who's asking with. If no one will be ineligible if they have a certain health condition. We are looking across really a wide range of different types of health effects. Some of these might be subtle changes. So we'll be analyzing blood samples for things like cholesterol and thyroid hormone levels and blood sugar levels, where you might not have a clinical outcome, but there might be slight shifts that we can see that are associated with PFAS exposure. And we are asking health history information as well. So we'll capture information about health conditions that people might be experiencing, but that doesn't make you ineligible to be part of the study. There is quite a bit of evidence linking PFAS exposure to many different types of health conditions, but really one of the things that this study is designed to address is to provide more information about at what level of exposure we might see effects, or see, at what level might you be at elevated or increased risk of effects on your thyroid or kidney or different types of health outcomes. And another component to this is exposures and mixtures. Scientists are good at studying chemicals one at a time, but we're all exposed to a mix of different PFAS chemicals. So we'll also try to address that component as well. In terms of how to interpret the results, there was recently a National Academies of Sciences report, which was designed to provide new guidance for physicians who are addressing concerns from patients who've had elevated PFAS exposures. One of the recommendations from the study was that people who might have had high exposures and want to get tested for PFAS should be able to get tested. Unfortunately, that is one of the benefits of being in the study, is that people do get to learn about their own level of exposure. And the other set of recommendations from this report included some suggestions or guidance about different types of health screenings that doctors might want to consider based on the results of the blood test. So we work with many different PFAS impacted communities, and one thing that I've heard over and over is, we can't change these high exposures. I have higher than average PFAS in my blood, but how can this improve my medical care? Like, shouldn't my doctor know about this? And so the report provides some guidance about, above certain levels of PFAS in blood, different types of health screenings that doctors may consider. And I think that this study that's currently underway that we're contributing to will also help fill in some of the gaps in our knowledge and provide better insight about, what are levels that might lead individuals to be at elevated risk of health conditions. So those are all really great questions, Trish. Thanks.
Yeah, those are good questions. I was
so
ready.
the other thing, it made me think when you were talking about the doctors and the testing, the testing and the levels that you're looking at from samples that you get from people in the study are different than if you go for your yearly physical and your doctor looks at your thyroid, your kidney, and all that. They're a different type of test, I'm assuming? They're not your average.
So some of the tests are the same. So the routine tests looking at cholesterol or thyroid hormone levels, we do cell counts. Those go to LabCorp. Those are, run just like they would if your doctor ordered those tests as part of an annual, or, in case there were any health concerns that your doctor was following up on. So those are actually routine measurements, but the PFAS blood testing is often difficult for individuals to obtain.
And it's surely not accepted by insurance.
Okay.
At
How
this
many
point.
different PFAS chemicals are you testing for?
So according to so all our blood samples will be tested for PFAS at the CDC laboratory in Atlanta. And currently they're looking for about 12 different PFAS chemicals.
Yeah.
do want
Understood.
to learn more. We know that there are many more PFAS out there. Not all of them accumulate in our bodies, and not all of them accumulate in our blood necessarily. But we do hope to apply some new types of tests. For instance, there's a test that can tell us more about the total amount of PFAS in a blood sample. And what that can allow us to do is say, okay, if we look for PFOS and PFOA and the other 10 or so that CDC tells us about, we add that all up. Are we getting at like 90% of exposure, or are we getting at 50%? How much is that gap? How much PFAS are we carrying in our blood that we can't identify yet? So we're using the study to provide some new information about the full range of exposures as well.
Laurel, you're going to be testing for more than the 12 with the other studies you have? The other?
So everyone who takes part in the study and provides a blood sample will have their samples tested at the CDC lab for the 12. And then the extra types of tests that I just mentioned, we won't be able to do those for everyone, but we will be able to on a subset of people who take part in the study and agree to be part of what we're calling our investigator-initiated study. So there's a core protocol that CDC is requiring from all of the 7 research teams in the study, and that's to ensure consistency so that we can compare data at the end. And then we have the potential to add on some additional tests.
Okay. I was asking that because when we did the testing for the Grove Pond water chestnut poll that we did, we paid to test for 24 as kind of compounds. So we had options of testing for the 6 standard ones that the state tests for. That was a certain amount of money. And then for like $50 more per test, we could pay for 24. So we went for the 24. And there was stuff on that list that I've never heard of, and so that was interesting. So that's what I was getting at, Laurel, with that question. I was wondering, it's like batched, and it was $350 per test.
Wow.
We paid for maybe 9 of those tests. We got a grant, and then we got extra money. So,
I think one of the things we haven't yet figured out about PFAS is that there are some PFAS that are no longer put into products in the U.S. anymore. These are the legacy compounds. These are the ones that accumulate in our bodies the most, and they're the ones that show up in blood most frequently. And then there are newer chemicals, some of those, we call them short chain or different alternative chemicals. They're in products, and we're likely exposed to them, but they don't really accumulate in blood in the same way. So they will show up in water samples, they might show up in soil, but they don't necessarily show up in blood. So I think that's why the CDC list is a little bit shorter, is that they aren't testing for some of these shorter chain compounds that they've tested for, and it doesn't mean they aren't accumulating somewhere else in our bodies, but they just don't seem to accumulate to measurable levels in blood.
Okay. So
we are also archiving samples, and that will allow us to hold on to them, and then if new testing methods become available over time, we'll have those in reserve and maybe be able to do some extra testing as well.
Laurel, is that just Silent Springs study that you're saving them, archiving them, or is that everybody?
Each of the teams has opportunities to add extra components on, so we're archiving samples from our participants.
Okay.
Some of the other sites might be as well. And then CDC also has some samples that they're archiving, so they might decide down the road to apply some different tests to samples that are collected under that core, that set of instructions that all of the teams are required to follow.
Interesting. Okay. I was going to mention too, if you hadn't already heard this, that those legacy compounds, the reason why such a tiny amount is toxic is because it attaches to the proteins attached to the proteins in our blood, in our red blood cells, and your body can't get rid of that fluoride bond. It's a super strong bond. So when Laura was saying she's looking at the total PFAS, she's looking for fluoridated compounds like the total amount.
Got it.
And then we could get a sense of the other fluoridated compounds.
see.
So there's thousands of them out there now.
Yeah.
So when somebody says PFOA free or PFAS free, you got to be
It's
careful.
not the whole story, yeah.
So is it my
It's
understanding
interesting.
that there are excluded classes though for testing and firefighters are one of the
Yes,
excluded
from this
classes?
test, from this particular study.
Yeah.
They should be tested probably by their medical doctors. As you know, the firefighters are really super exposed
Yeah.
from
Yeah.
both their work and what they have to wear. Yeah. And the military was required to use AFFF foam. That was mandated
Yeah.
because it works better.
Yeah.
Mm.
It's more expensive. That's why Ayer did not use it. so that's what I was told. I tried to summarize on this so we could get through agenda fairly quickly, but the handouts that I distributed are the things that we are currently starting to do our outreach with. So we created a nice brochure. Julie's mainly the designer of this brochure.
Highly updated.
We've updated it a few times. And the different flyers, we've had several different versions of these flyers. I just want to point out that one of the pictures in particular is an Ayer family. You may recognize the Gibbons
Oh, yeah.
family.
Nice.
And so we worked hard to get permissions from
that's
the
so
newspaper
nice.
because we wanted it to be personalized for Ayer.
Yes.
And we're trying to get the attention. So we've had several different versions of these sheets, and it looks like you got one that has only one side. That one has one side, but the other one should have a double side.
Yeah, this one's double.
Yeah, there's different versions that I might have grabbed some of the wrong ones. Just that's what I'll get
Is
you.
this
different-
the other side?
Yeah, Julie, can you hand
That's
her
okay.
hand her yours? So we are gearing up, and we have this summary sheet. We have other sheets that are more detailed. This is the one that we're starting to use with our outreach campaign. So I just wanted to kind of go through this sheet with you. We have a couple of things that we're hoping you can help us solve or work toward a solution. And you may have some insights that would be really helpful for where we are right now in the study. So just quick summary. I mentioned we've already started in Hyannis. We actually started in November of 21. We're struggling in Hyannis because the people are not responding. All this time, they've only been able to get a couple hundred people, and their goal is to get 700.
Wow.
So not sure why, but completely opposite from Ayer, we are getting
Yeah.
so much support from every aspect in Ayer. It's been just really outstanding. For whatever reason, Ayer residents are really open to this. The people we're talking to, most of them are familiar with the problem. Many of them are signing up right away. Oh yeah, I want to have this done. Everybody from you, I think you were the first board that supported us so strongly when we started all of this. But the board of selectmen, or the select board, and the schools and DPW, everybody all the way down is being super supportive and letting us table at various events and so on. Hyannis, not at all. They're not allowed to distribute at the schools. They're not allowed to exhibit in a number of places. So it's been a really difficult problem there. So yay Ayer, we may end up with some of their allocation of participants because they're not getting them there. So the original plan was that the equipment that had been set up in Hyannis was going to be moved to Ayer after they were done, but they're not done. So Laurel has to buy 2 sets of everything, which includes a minus 80-degree freezer, which we're having trouble getting. And that's kind of holding us up right now. So anyhow, we do have an office space. Both Robert Pompriand and Alan Manoyan helped us to make a nice connection there, and they helped barter the cost down a little bit, so it was a little bit high for us to reach, but we got it into a price range that we're there now, and it's been a wonderful space. So we have an official medical office building, or medical office suite, and over there. We've been there for a little while now, a couple months, and Laurel has hired Emily Heckel, and I think other people hired the other 3 assistants. They're paying for different organizations. That's not really important. They've been training for a while. It's a very complicated protocol. If you've done anything with lab samples and blood work, they have to take Well, we're going to use the phlebotomy lab at the hospital, so we don't have to hire a phlebotomist, which is good.
Okay.
But the samples then get walked back to our office space, and they have to have the equipment to spin the samples, and they have to come up with like maybe 7 different ways of spinning the samples and doing different things with each one, and they have to go to different places. So it's a very meticulous protocol.
Yeah.
It's going to take a lot of careful tracking and training and so on. So the 3 women that are there are being trained to do all of that, as well as do some screening and things. But it's taking a lot of training to get us to this point. So we have been providing them with lists of people who have expressed interest in participation, and this is coming from the PACE list that's been kind of ongoing for some time, as well as specific events that we've attended and asked people about participating in this. And just this week, well, actually at the end of last week, they started making phone calls to screen people to make sure they were qualified with the criteria of you had to have lived in Ayer the right amount of time that's on that sheet.
Yeah.
It doesn't matter how much time, it could have been a month and you're still qualified. You could have moved and you're still qualified. So we want to get children up through adults. So like my kids have moved away, they went to college, they lived away, but they're qualified. So I want them to come back and get tested. And everybody gets gift certificates if they complete the certificate. We started by practicing with people who are actually not qualified for various reasons. They either don't live in Ayer or they have private water. There's a handful of people that have private water in Ayer.
Yeah.
So that was just to kind of, they're not doing the urine or the blood samples, but they're just to practice the questionnaires and go through the protocol and get them to sort of feel comfortable. Yeah, the body measurements, and so people will get gift certificates. We're trying to focus with most people more on you'll get the results of your test. So I feel like that is really important.
Yeah.
There are some people that were getting their attention by saying, especially to the young people, I was at the football game on Friday and teenagers are walking by and going, hey, want to earn $75?
Yeah,
So that got their attention. So they have to go through their parents. If you're under 17 or under, you have to have your parents sign you up. But they would be qualified. So a whole family can sign up, and that's a good chunk of money. If you have 5 kids and they all sign up, 2 adults, 1 adult, that's good money.
That is true.
So that does help. Let's see, so you see our goals there. The original study was to get 1,000 people between Hyannis and Ayer. Our allotment was about 1/3 of the total because Ayer is about 1/3 the size. But as I mentioned before, our 300 adults may go up to a lot more if they continue to struggle in Hyannis. Our goal is 100 children, same thing. I mentioned the supply chain issues. So if anybody has knowledge of where we can rent space in a freezer that's really low.
You might have some ideas on that.
For freezers?
Yeah, for
Yeah.
freezers.
There should be a lot of them available because the vaccines, the Pfizer
yeah.
vaccine.
They
that
tried to
was
get them
stored.
used, but for various reasons.
They
Laurel,
should-
any
they
ideas
should-
on where else to look for freezers?
Let me think about it.
But do you need to have it in your own space?
Well, we have one on order. They
Okay.
can't seem to get it to us for some reason. It's been a long time. They keep saying, next week, next week.
Is this a transportation issue or
I don't
what?
know. I don't know what it is.
How big is this freezer?
Laurel, how big is the freezer? Still there?
I'm still here, yeah. It's a bit bigger than a regular, like, refrigerator you'd have in your house. I don't think it's a size issue, it's just, I don't know, I think there's still a lot of things backed up with the supply chain. I mean, our freezer's waiting for us patiently in a warehouse, and we just haven't been able to get it to us.
Okay.
So I
Maybe we
did
should
just
drive
reach
out and
out
get
to the
That's
CDC
what I was
today
thinking, yeah.
and just ask whether it's essential to the protocol to get the samples frozen down to that low temperature like the same day, or could we have a regular freezer, at least get the samples frozen right away, and then then transfer them to the -80 freezer when it comes, or look to one of our collaborators at Harvard School Public Health where we might be able to move the samples. So it's not the thing holding us up right quite yet, but we might be getting to the point where that is kind of the last piece to get in place. So we're looking for alternatives and just trying to, I don't know, hope for the best and plan for the worst. I guess.
Yep. No, that goes.
Yeah, it will be in like 2 more weeks if we
Absolute
don't.
zero is
You have an idea?
For some bizarre reason, I know it's 273 Kelvin. But
Not private
I
conversation.
think. I'm not sure why I know that.
All right.
Okay.
Well, if you have any great ideas, you know how to reach me. So, yeah, we also looked at renting space in various places. Like we asked the hospital if they have
Yeah,
one. And
that's
Oh, yeah.
they have a -20. They don't have a -80.
really. This is
So
more
Laura's
a
looking
niche
into
product than we
I know.
realized.
I know. It's crazy. Okay, and just we wanted to impress you with all the outreach that we're doing. So we listed a whole bunch of things.
Yeah.
We're looking for all kinds of ways of reaching people, so we're open to any ideas you have. We've been to the schools. We were just so delighted with this. We were allowed to give a presentation the day the teachers went back, and they have a full day of
Yeah.
teacher
Oh, yeah,
meetings.
yeah.
They let us come and speak for 15 minutes in front of the whole school staff.
Oh, that's great.
So when I walk into the school now, people know who I am, and Laura was there too. So we gave them an abbreviated
That's
slide
awesome.
program, and we're going to be able to give them backpack flyers and releasing the newsletters, and all the principals are being very supportive. So
That's great.
Dr. Runda all the way down, it's like
I love
night and
it.
day. Yeah,
Mm.
it's they
That
they
is
recognize that this is benefiting their kids,
Right.
Yeah.
and because there could be all kinds of things that PFAS
Right, you
is.
don't know.
Yeah,
What do
we
you
don't know
know?
yet. So I just mentioned all the different ways we're getting supported. Even at the football game, they put up 2 tables for us. They brought them out for us. We didn't have to
Yeah.
lug in our own tables like we usually do. So it's really amazing. And we're hoping to table at a town meeting is no problem. I don't know if we're allowed to do it at election day. I have to find that out. Maybe outside. We might be able to be outside at
I
some.
bet you could do it.
I bet.
We're not
when
electing
election-
anybody, so.
No, but I
Right,
mean,
yeah.
when I used to come to vote, they had the ladies out there for the 4th of July.
Yeah.
Yeah, that's
Yeah,
right.
it was-
Yeah.
It's
not-
They're selling stuff.
It's
Yeah.
nothing to do with an election. It's
No,
yeah.
so you should
I have
be
to
able
find out. Yeah, I have to officially find out. But that's our hope, just to
Yeah, that
have
would be
some
nice.
information there.
And you're doing lawn signs. Awesome.
We are also in the process of preparing lawn signs and postcards, and we're going to have a mailing to every single address in town that has public water. Again, we've been able to
That's
get the mailing list from Town Hall for no charge. They just
Yeah.
emailed it to us. It's been amazing.
So why don't you have something go out with the water bills?
Something what?
The town issues water bills, I think.
Yes,
3
we did
times
ask
a year.
about that. They source that out, and we can't use their system. We have to do our
Oh,
own.
that's right, because when you pay it online, it's, you go through that town.
But the actual document that's printed, they couldn't add something to that?
Apparently not.
I don't know.
I'll ask
The
again.
regular DPW even sends those out.
Can we add a
anymore.
comment?
That's all
But
part of the.
whoever they're working with, I don't understand, the form has to have flexibility of information. It says Town of Ayer, why couldn't they add that
Yeah,
to the form?
right, why can't you
Yeah.
stick something in there?
They used to. They used to send little flyers about how to save water and stuff like
Yeah.
that.
Yeah.
Yeah, I'll ask again because they had to change their vendors
I
apparently.
think that's, yeah, we might be able to send reminders that way. I think also one of the issues is that not everyone's water bills go out at the same time.
Yeah.
So we did hope to do sort of a big push, over the course of a few weeks and get everyone's attention at once
Yeah.
about the study. And I think the timing of the water bills, those would go out over, I don't know, months. I don't know if you get those every
Quarterly.
quarter or
Quarter,
however.
Yeah, the
Yeah.
quarterly bills.
Quarter.
We just
So some people might get it over Christmas or,
Yeah,
rather
yeah,
than
true.
sort of us being able to plan the timing. But it's a good point. We might want to send reminders out that way if they would let us, as a follow-up.
Yeah,
So
I
we
think
should
that's a
ask
good
Ann
idea.
about that.
Yeah.
The other option might be that mailing that goes out for the census and dog licenses that goes out from the town. Now, that doesn't go out until January, so it might be a little late for you.
No, we're actually doing this into May, so if things are slow, that's a great idea.
Okay, because that goes to everybody in town at least.
The other thought I had, now that you're up at the medical office building, I can't remember the woman's name who was the liaison.
I know who you're.
Yes,
I know, and I can't come up with
Um,
her name now either.
at the hospital.
A liaison?
Someone that, what's the title?
Like a community.
Community outreach person.
Yeah. yeah.
That makes sure that things get discussed or posted or whatever. as far as Steward Health or whatever they're called now. I
Yeah.
remember.
Her
I'm
job
wondering
is
about-
to
But
reach out
you're,
to.
yeah, you're up there
Mhm.
now. You could find out in the office up there, who their outreach person is. There's a,
Yeah.
she would come and,
Yep.
and speak on behalf of the hospital, what they're having for workshops, or they invited us to an opioid,
Yep.
seminar that was up there with Dr. Hussein and another doctor, because they were talking
Yeah,
about
right,
the,
right.
Okay.
Yeah, there is somebody in that
Yes.
position.
Okay.
And you might be able, through her, to get to, I mean, I would venture the entire town of Ayer sees one of probably 4 or 5 doctors for their like regular GP. If you could somehow get, even some of the really, more popular just general practice doctors' offices to
Yeah.
put something,
Just get our flyers
even
in
just
our
something in their
offices.
waiting room.
yeah, in their
Yeah.
waiting room.
Yeah.
Yep.
What else
We
was
did
there?
actually try to pull together a list of what doctors people see, and this is just asking our friends, asking each
Yeah.
other,
Yeah.
and we came up with a fairly long list of
Oh, really?
people in Groton and Harvard, and I go to Acton.
Oh, wow. I'm kind of surprised.
Yeah.
I thought everybody goes to Preston.
What's that?
I go all the way to Holden.
You do? Wow.
Yeah.
Okay, but yeah,
Wow.
reaching the doctors would be really
Oh,
helpful.
and
Yeah.
and it's kind of a running gag whenever people want to announce something up at the transfer station. There's always,
Yeah.
Oh,
You know.
yeah.
That is on our list.
Yeah.
Actually, I didn't mention it. Yep.
yep.
Yep, the town crier. That's
Yes.
essentially our town crier.
And I know it's on the PACE website, but on the Airtown website.
How do we get it on the Airtown website? That's one of the things I want.
Sam, do you know how who's in charge of that?
So Cindy Knox is in
Oh,
charge, but
that's right.
she
Cindy's-
retired last week.
She
What?
did?
Yeah.
She did what?
Yeah, she's all
She
done.
didn't clear that
She's
with
so
me.
young.
She retired, so
Oh,
website's
no.
a bit in limbo, but I
It's
can ask
posted.
around to see.
Oh,
It's posted.
Yeah.
I can ask around to see. She's still gonna be. I think she's got like 2 days left or something. She's on
Holy
vacation
cow.
right
wow.
now.
God.
So,
Wow.
but
I
I can
didn't
ask
know
around to see.
Okay.
About getting stuff and who's sort of temporarily taking it over.
I
Yeah.
didn't know that.
Yeah.
But I can
Send her
also
an
take some
email,
things.
please.
I've been making a bulletin board outside my office for the Board of Health so that there's some more advertisements
Okay.
and people don't just think it's the building department.
That sounds good. You have posted PFAS stuff on the Board of Health website
Mhm.
a while ago.
And we can do that.
Can you?
Yeah.
Okay.
Yeah, I mean, if it's okay with the board,
I think we
could
always have
authorize
whatever
a
you-
link.
yeah.
Okay.
Yeah.
When I search PFAS air now, it seems to come up under a list that's, some of it's under select board, some of it seems to be DPW, and some of it is you.
I think,
So
yeah.
I don't know
I think
so.
it's in a bunch of different
Yeah.
places because of the water testing.
Yeah.
and-
Yeah.
Mm-hmm.
Okay.
But I can ask about the website anyway.
Okay.
Oh, thanks.
Thank you. That would be great.
And then just regular Facebook.
Well, PACE is, you have a page, right?
Yeah, we do, but
Yeah.
that certainly doesn't reach everybody.
Right.
Yeah, you need that air
Have it.
town.
See if you can get it shared by the town's Facebook.
Yeah.
That's what I'd like to do.
So
Yeah.
I would say before all you have to do is email Cindy. So we'll see what we can do with that.
Okay, okay. See, I think Cindy needs permission from some official board member to post things. I don't think she can make the decisions. That was my impression.
I
Like,
know.
somebody with authority would need to authorize it.
I think it's usually just Robert. So
Yeah.
Okay.
because I know. Yeah, because we used to do library stuff, and we would just say, "Hey, can you share this?" And she'd go, "Yeah, sure." And
Oh,
ask the
but
board.
you're official at the library, so,
The
Yeah,
library
that's right,
too, yeah.
library.
Yeah.
yeah, we want to have a display
You
at the
always
library.
did, yeah.
Yeah, yeah.
Yeah, I'll just see how they're handling that at the moment. Because I
Thank
have
you.
other questions I have for them.
The other thing we wondered is, we're also trying to reach former residents, people who moved on. Do you by chance have access to information from people who have moved on for any reason? Or
No.
does like the Neshoba?
No.
No.
Oh, you mean names or?
Yeah, yeah, like forwarding addresses or something.
No.
I can't think
No,
of.
sure.
We
yeah.
wouldn't.
We
As a board, we
definitely
wouldn't.
Okay, I didn't know if there's any health reason why you
They moved
might.
on because they were military and
Oh,
they're
yeah.
still involved in the military at all. Clear Path on Devon's would be another source because there's people that
Yep.
lived in Ayer that are still veterans that participate with Clear Path.
Is that a
That's
residential facility or
No.
Cleartown?
It's a
It's a
veteran service organization.
Okay,
Clear Path, yeah.
Clear Path.
Oh, what was the name of that? Can't remember. I'm drawing a blank. You spoke to the gentleman up there when we had.
That's Clear Path.
Yeah, at Clear Path.
Yeah.
He came to one of our meetings.
Yes, he did.
Can't remember his
I
name.
don't remember his name. no.
Okay, but Karen Swanfeld is a volunteer up there.
Oh,
And she's posting all the time, things that are going on at Clear Path.
And
so they have a Facebook
That would
page
be
then?
good.
Well, they
The Clear
have,
Path has,
they
right?
have a luncheon every Thursday for veterans, and they usually get a couple hundred veterans from the area, so there may be people that lived in Ayer.
Yeah.
Do they
Yeah.
have presentations during those Thursday lunches?
Only momentary, so if someone had a 5-minute presentation, yes. But in
Okay.
terms of a full-blown presentation,
No,
I don't believe so.
but I could go
You
and
could
at least,
probably leave
You could probably have
information there,
flyers.
and
Yeah,
you could
bring
ask
your
people to
info.
pick it up.
yeah, and then I could just sit there while they're eating and they could
Yeah.
come and talk to me.
There you go.
Okay.
Yeah.
I'll make sure I eat before I go. So. Cool. Okay, that's a great suggestion. Thank you for that.
What about some of the little, well, like, I think of Pauline's corner store near me. I mean, I think probably, again, 3/4 of my neighborhood goes through Pauline's
Just
at least once a week.
Okay.
I wonder if places like that or
Have
even
flyers.
Alltown or some of the other
Yeah.
gas stations might let you do flyers or
We're going to try that.
post a notice.
Yeah, it's interesting. That's changed a lot recently because I used to be able to put flyers all over the place, but even like the Main Street Bank, they don't have that bulletin
Yeah.
board there anymore. The community bulletin board they used to have,
Yeah.
it's not there anymore.
Yeah.
Yeah, so
I
Dunkin'
know
Donuts
they-
won't allow
Seems
it.
like everybody's tightening up on what.
For whatever reason. Yeah, but I can try that. Yeah, Pauline's might. That's a good idea.
It's a great, and I think Lazy Mary's gets a lot of people through there ordering lunch, you know, even like places like Verona and,
Mm-hmm.
you know, Tiny's. Town goes to Tiny's.
Oh, Tiny's does have a board, I think, when you
Yeah.
walk in the back door.
That's what I'm thinking, yeah.
Yeah,
Chinese, yep.
that's a towny place.
Coffee
Yep.
roasters, they closed.
Oh,
But the new coffee place just
Yeah.
opened.
Oh,
Yeah, I
Right.
haven't
Yeah.
tried that yet.
Neshoba.
Yeah.
We go to Neshoba
So
Live.
one, I'd
Usual
like to
townie
add
halls.
something. So one
With-
thing that we've learned in Hyannis, so we, you know, have had, like Lori said, we've had some challenges. The school system has not been nearly as receptive to handing out information and not receptive to having us be in person at schools. But we have had success having an informational table in front of the Stop and Shop or Shaw's at community events. Like, I think flyers are really important, and some people will respond to flyers and to the mailing. But for some people to, you know, get them to really commit and put their name down, it's going to take a, you know, a one-on-one conversation. So I didn't know if any of these stores where you're, you know, thinking about bulletin boards or places to put up flyers, if you think they might be at all open to having, you know, a member of our team have an informational table now and then to talk to people in the grocery store or, you know, the coffee shop or these other locations. Because again, it's that all the awareness and the postcards like helps people know about the study, but for some people, they'll sign up no matter what, and for other people, it's going to really take a conversation with them to get them to sign up.
Yeah. I think that
Yeah.
would be through the individual establishments themselves. Or have you thought about tapping the Neshoba Valley Chamber of Commerce?
Thought about what?
Neshoba Valley, the Chamber of Commerce, they might know of businesses that would be receptive to you.
Yeah, so I've not had any involvement with them other than occasionally reading, you know, their Facebook page or something, because I always thought it was more of a regional thing, like the whole Neshoba Valley, all the towns around us.
But
Plus
they
it-
might, they might be able to give you information to connect with our
Just Ayer.
community.
Okay.
You know, because they are our chamber members.
Mm-hmm.
Just a thought.
Okay. They do a lot of presentations too.
Yeah, we're gonna
I
have
mean,
to.
we could do a general
I
PFAS
just have to,
presentation.
at 7 o'clock, remember to unlock the door.
No,
Oh, okay.
I was gonna say,
Make it
are there other things that you wanna talk about quickly, because I think
Yes.
we're running on now. so-
Running right at one time, yes.
Okay.
The other piece of this that is equally important is we need to also determine, and Laurel's working with other people on this, we need to look at how the exposures happened in terms of where did your water come from? Was it more spec pond water? Was it more grow pond water? And over time, how much PFAS was in that water? So as you know, we don't have those data points until we started looking for it in 2016.
Yep.
Or 14 or whatever it was.
Yeah.
We need to go back further in time, and so we're doing a tremendous amount of work behind the scene to look at historical information about how much water came from each well, and we've actually been able to work closely with DPW with this amazing modeling system they have where they can know where your water came from on a given month, at a given time frame. They have nodes all over town, and they use it going forwards. We needed to go backwards. So, they need to predict
Yeah.
if this neighborhood is using a lot of water for whatever reason, they're watering
Yeah.
their lawns or something, they need to send more water from there, and where did it come from?
Sure.
So we're using that, and they're helping us figure out how to go backwards in time. So what we're lacking right now is some of the hydrogeologic information that we think probably exists somewhere. And so we're working with DPW, and we're trying to get information from Spec Pond over the list of documents that you see here. So I won't read through them because you're familiar with most of them, but like Zone
Yeah.
2 information. We understand that Guilford, AKA, what did they become, Pan Am, and they may be CSX now, they were
Yeah.
supposed to do modeling information to keep track, monitoring information to keep track of any contamination that happened, and we've never seen any of those results anywhere, and nobody seems to know anything about it. But that was in their mandates way back when all that stuff was going on.
Yeah.
We think that Littleton probably has been keeping track of the property. Most of that land is their land, not our land. We think they've been keeping track
Interesting.
of the groundwater data, but because of the lawsuits that are going on, they're kind of shutting down and not talking to us. And they're not
right,
sharing some
right.
of the data we think they have. So they have PFAS in their spec pond wells too. We don't
That's
think it's the same source as
interesting.
ours. We think it's a different fingerprint, but it's pretty complicated. So I've talked enough with you. I've taken enough of your time, but I think you get the sense of what we're trying to come after. And Neshoba Board of Health may also have, Associate Board of Health may also have some of this information, but I didn't know if you might have archives. They're probably not electronically available, but we need to go back to about.
Right.
Laura, are you still there? Maybe she's
Yes,
gone.
I'm still here.
Oh, how far back in time do we need documentation? Oh, 2000? Back to 2000? For groundwater studies?
Yeah, thanks for raising the historical reconstruction. So we asked our participants where they lived in Ayer back to the year 2000. And so the estimates that we want to develop in terms of what the PFAS levels were in the Ayer water supply before anyone's starting to measure them, we want that to go back to 2000. And there's kind of two ways to approach that. One is to look at the conditions now in the groundwater and try to kind of predict backwards, like where would that have come from, how concentrated would it have been, further upstream in time past. And then the other approach is to say, okay, well, we think this much firefighting foam was used, or we think this much entered the groundwater back in, 1970s or 1980s, and try to model that forward. And so we're working with a hydrogeologist team, and they're still in the process of evaluating what models are available, what data is available.
Yeah, Laura, I copied the whole list that Jane was asking for and gave that to the board.
Okay, great.
That's
So,
really
so the modeling itself might go back earlier than that, but the period of time that we want to estimate the drinking water concentrations goes back to 2000.
Okay. And I'll just close by saying we also have a lot of information from the Army It's not quite on, and we know that the Army is working on exactly the information we want, but because it's still in draft format, they are not releasing it to us. So they're looking at PFAS exposures and going back in time. We have some anecdotal information, some solid information about big fires that happened at Devens
Yep.
or Fort Devens, and they used PFAS foam. We know they did, but we think there's a whole lot more.
I remember when you were going back to the records.
Yes,
the
that's right.
firefighting records.
Yeah.
Did that turn up?
It was
good
helpful.
information? Yeah.
We went through the firefighting logs from Fort Devens. We didn't complete it. It was very, very tedious, laborious.
Yeah.
But we did a lot of those years, and the records are handwritten, and they're occasionally talk about specifically using foam. But most of it was not the kind of information we needed to prove that that's what was used.
Okay.
So they interviewed some firefighters and got that kind of information anecdotally.
Tannery, all I can think of is
Tannery.
tannery.
Foam didn't exist at the
No?
time.
Really?
When did that,
Good
70s?
thing.
What's that?
70s?
AFFF was probably in the early 80s.
Are you a
Oh,
former
that one,
firefighter?
okay.
I am.
Oh, I didn't know that. I didn't know that.
I'll talk to you after the meeting.
Ah!
Full of
But
PFAS.
I think going forward, we appreciate everything that
Yeah.
you're doing, and I think you've got the support. If there's anything that we can help you with, I think we'd be more than happy to. But a lot of this falls outside the purview of anything that the Board of Health. I was on the Board of Health with her mother in 1983.
I thought it was earlier than
I love
that.
these small
Her
ones.
mother and I shut down the Ayer High School
Oh, gee.
because of asbestos.
I found that article the other day.
Really?
Yeah, the roof was a flat roof and it was leaking. And the soundproofing in the high school was sprayed on soundproofing, which was asbestos based. After it gets wet, it becomes friable. When
Yeah.
it becomes friable, it becomes airborne.
Yeah. So you shut the high school down?
We told the school committee we were going to, and they said you can't do that, and we scheduled an emergency meeting. And the school committee did the right thing and shut down the high school before we could.
Huh.
We would have shut it down.
Wow. That
We
happened.
had the scientists that wrote the asbestos guidelines from MIT do the study in terms of the level of asbestos in the high school. And with what he told us, it was risk.
Yeah.
Wow.
Yeah.
Do you remember the year?
I do. 1983, I believe.
83.
Oh, if you saw the
Yeah, it was 83.
83.
There's great pictures of children with all their books just
Walking
leaving
out.
school.
So they just closed
Anyhow.
school for a week? They
Oh,
No,
closed.
they had-
Fort Devens volunteered to let them use barracks and they moved the entire high school to
Oh my
Fort
goodness.
Didn't they have portable, didn't they do portable?
Kids got to go from barracks to barracks for classes. Anyhow,
Well, let's go with Devon's
we're dragging on, and like I said, I appreciate it. Do you guys have anything?
No.
Because I think we
No.
should have a motion to adjourn.
I have one thing for you to
Okay.
Okay, I can still sign it.
sign. There's a new solid waste hauler in town.
Is there a motion to sign the solid waste haulers permits? Are you guys good with that?
I will so move.
Second?
I second.
All in favor?
Aye.
I'll sign it. Thank you. So, motion to adjourn made, seconded. All those in favor?
Aye.